alaikum everyone. I'm Asad Hussnain and I'm a student of University of Sialkot, and today I'm going to talk about caffeine related disorders. First of all, what is caffeine? Caffeine is a natural stimulant most commonly found in tea, coffee, and cocoa plants. It works by stimulating the brain and central nervous system, helping you stay alert and prevent the onset of tiredness. Nowadays, 80% of the world's population consumes a caffeinated product each day, and this number goes up to 90% for adults. Caffeine is most commonly consumed by drinking coffee and tea, but is often a key ingredient in energy drinks too. So, there are some disorders that are caused by caffeine, consumption of caffeine. Caffeine related disorders are a group of substance use disorders related to the use of caffeine, a psychoactive substance, classified into caffeine intoxication, caffeine withdrawal, other caffeine induced disorder, unspecified caffeine related disorders. Caffeine intoxication. So, caffeine intoxication is actually a diagnosis assigned to individuals who experience symptoms like restlessness, nervousness, insomnia, or digestive issue after consuming a high dose of caffeine. So, caffeine intoxication is caused by consumption of a high dose of caffeine. Relatively speaking, what's high for one person may not be high for another, but it's classed as being well over 250 mg per day. For example, if you're taking coffee, then 250 mg per day is enough for you. But if you are taking more than 250 mg per day, then it can be harmful for you. More than that, the symptoms of caffeine intoxication can be distressing and affect areas of individuals' functioning, daily life functions such as work, school, or social life. The next one is caffeine withdrawal. Caffeine withdrawal is actually another type, or you can say disorder. Withdrawal from caffeine causes mild to clinically significant distress and impairment of normal functioning. Study has demonstrated that caffeine withdrawal occurred after as little as 3 days of caffeine exposure, with a somewhat increased severity of withdrawal observed after 7 or 14 days of exposure. So, if you are taking caffeine on daily basis and you're addict, then leaving caffeine or withdrawing from caffeine is actually hard, and you may feel restless, headaches, and many other problems like this. Also, withdrawal from caffeine causes mild to clinical significant distress and impairment of normal functioning. The severity of symptoms vary from individual to individual. For example, most commonly it includes a headache, mm, decreased energy, activeness, or decreased alertness, all these symptoms. But in some situations, it can also cause depressed mood, difficulty in concentrating, irritability, and feeling foggy, etc. The next one is other caffeine induced disorders. Caffeine induced anxiety is a condition caused by consumption of excess caffeine, resulting in the individual feeling extremely anxious. Some common symptoms associated with caffeine induced anxiety are restlessness, nervousness, confusion, shaking, and insomnia. And the next is caffeine induced sleep disorder. Caffeine induced sleep disorder results from overconsumption of caffeine. For example, if a person consumes caffeine immediately before bedtime or regularly throughout the day, then the sleep delays, total sleep time reduces, normal stages of sleep later, and the sleep quality decreases. In simple words, caffeine induced sleep disorder is a psychiatric disorder that results from overconsumption of stimulant caffeine. The next one is unspecified caffeine related disorder. Unspecified caffeine related disorders are the disorders which do not meet the full criteria for any specific caffeine related disorder, but they cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Let's talk about the symptoms. Symptoms can be seen as nervousness, restlessness, excitement, facial flushing, muscle pain, nausea, upset stomach, a lack of focus, nervous energy, etc. Causes of caffeine-related disorder. What causes these disorder? Environmental factors could be a cause of these disorders. Genetic factors, for example, if someone in your family is already diagnosed with one of those disorders, then there are high chances of that individual getting these disorders. Then friends gathering, tension and stress, sleep disturbance, insomnia. Treatment, since caffeine related disorder is not recognized as a diagnosable condition, but for preventions, these are the following strategies we use to control caffeine related disorder. We can psychoeducate, we can use counseling therapies, we can provide motivation to eliminate caffeine from your daily diet, and then we can use some medications, but I would recommend you to go to a professional. And then you can also increase your water intake. You can replace one caffeine drink a day with a caffeine free option. For example, if you normally drink 3 cups of coffee in the morning, try swapping one of those for an herbal tea or hot water with lemon. Then you can add exercises in your routine. That's all from my side. If you have any questions regarding this topic, you can ask in the comment section. Thank you so much for your time.